Story 1. I am not a doctor, but I am an emergency room nurse. A man came in thinking he had bronchitis and requested testing to calm his family. His chest X-ray showed coronavirus disease 2019 pneumonia, and the test result was positive. He insisted he needed to see the test results to believe them and said he would not tell his family because he did not believe it. He refused admission and left against medical advice. He returned 2 days later with oxygen saturation in the 70s. He spent about a week in the intensive care unit, was intubated, and died. Story 2. Not directly related, but with visiting not allowed, we made more of an effort to call families and update them. I was on a ward not treating patients with coronavirus disease 2019 and was updating the family member of an elderly patient. The family member asked about coronavirus disease 2019 swab results. I used my most reassuring tone to say the results had been negative so far and that we were doing our best to keep it that way. He responded, "Negative, well, how about that?" and then went on a rant that it was all a hoax. Story 3. I'm not a doctor, but I am an emergency medical technician. We were called for a person with difficulty breathing. On arrival, we found an 87-year-old female in the tripod position with visibly labored respirations. Dispatch warned us of COVID-19 symptoms, so I wore full personal protective equipment: gown, gloves, goggles, an N95 respirator, and a surgical mask. We assessed vital signs and found her oxygen saturation in the low 80s, with a respiratory rate of 28 breaths per minute and bilateral rales and wheezing. While I obtained vitals, my partner asked her some questions and a trainee requested medical history from her daughter. The patient spent the entire time yelling that it was a hoax and told me to take my mask off. We refused, and I told her I needed the mask for my protection and that we needed her to put one on. She said she would not put one on, but she was too weak to resist, so we put a mask on her anyway. She insisted she did not have COVID-19, even though her daughter said she had a recent positive polymerase chain reaction test. In the ambulance, she tried to pull my mask off. I warned her that if she tried that again, I would restrain her. She then called me a sheep and said I was killing myself while she struggled to breathe on 15 liters per minute of oxygen via a non-rebreather mask. Story 4. I work in dermatology, and although not intuitive, there are many skin manifestations of coronavirus disease 2019. Some manifestations are relatively specific, others are not. I had a patient in our outpatient clinic who presented with pernio, one of the more specific skin manifestations of coronavirus disease 2019. She flatly refused to wear a mask to her appointment, refused to allow us to perform a swab test for coronavirus disease 2019, and proceeded to tell me that coronavirus disease 2019 was a hoax. Given our high suspicion for coronavirus disease 2019, we closed the clinic for the day for the safety of our other patients. One of my nurses tested positive 3 days later despite self-isolating, and we had to keep the clinic closed until all other staff had negative test results, which took 10 days. Although this was costly to my practice, what bothered me most was the inconvenience to the other patients I was scheduled to see that week. One patient whose appointment was postponed was subsequently diagnosed with melanoma. That likely did not change the disease course, but it was still distressing to see. The nurse remained healthy and experienced only a mild course of illness. It has been shown that patients with pernio often have a less severe course with coronavirus disease 2019, which probably contributed to the patient's mild illness. I have not seen the patient again. Story 5. I am an intensive care unit nurse with 6 years' experience. I have cared for patients with coronavirus disease 2019 since March 2020. We had the first confirmed case at our hospital. November through February was rough. I had a 2-week stretch where every day 1 or 2 of my patients would die. We were sometimes assigned 3 or 4 patients. The norm is 2 patients to 1 nurse, or 1 patient to 1 nurse when on certain equipment. Most patients understood the severity of their illness. A handful did not believe they had coronavirus disease 2019, even though removing their high-flow oxygen or bilevel positive airway pressure support would drop their oxygen saturations into the 60s or 70s. Many had comorbidities that increased their risk, such as chronic obstructive pulmonary disease or asthma, obesity with sleep apnea, and smoking. I think people refused intubation because they feared the outcome. Fight, hope, pray, fingers crossed, delaying the inevitable. Our intensive care unit attending would have them sign consent for intubation when they were coherent enough to do so. Almost all of them died. Very few survived, and those who did were still very sick and debilitated, some requiring tracheostomies. One case in particular sticks out. This was right after Christmas. A 21-year-old man with a history of type 1 diabetes mellitus, obesity, and sleep apnea who did not reliably take his insulin was admitted with coronavirus disease 2019. He did not believe he had it and should have been intubated days earlier but refused. He ended up being intubated emergently. It took about 5 of us to prone him because his oxygen saturations were in the 60s. We could not detect a pulse. There was no waveform on the arterial line. We had to flip him back over to perform cardiopulmonary resuscitation for about an hour before we called it. He had a child and a fiancée. Honestly, it was often the families who denied their loved one had coronavirus disease 2019. They were upset, understandably, about not being able to visit. Video calls just do not cut it. My mother and father are coronavirus disease 2019 deniers, even when I tell them what it is like. Well, those people had other things wrong with them. They were older, they tell me. They send me links about conspiracy theories related to the disease. I received the Moderna vaccine in December and January and still have not told them. It is awful. The facial swelling alone from being prone is enough to give a person nightmares. Watching someone go into multisystem organ failure, needing dialysis, being unable to place them on their back, being at maximum ventilator settings and still not having enough support so barotrauma collapses a lung that then requires a chest tube to reinflate it. Families saying do everything, even though their loved one had experienced cardiac arrests once or twice. Hearing families on video calls crying, praying, and singing as the patient is intubated, sedated, and paralyzed so the ventilator can do the work. Tearing up under all the personal protective equipment because we are still human. We work so hard and sometimes it does not matter, but we go back day after day. I wish people who do not believe could see what I have seen. It might scare them enough to take precautions seriously and get vaccinated. Story 6. I am the charge nurse in the coronavirus disease 2019 intensive care unit. A woman tried to leave the emergency department against medical advice while infected with coronavirus disease 2019 and in need of a large amount of oxygen. Our doctors convinced her to be admitted. My wife had been her emergency department nurse and brought her to me. The patient was yelling, ripping off her mask, spitting, and telling us we were all sheep while gasping for breath. Our doctors told her she was close to needing intubation, a breathing tube, and she just scoffed. We contacted her husband, who swore at and berated us, saying we were keeping her prisoner, that no visitors are allowed in our coronavirus disease 2019 unit, and that none of this was real and it was all for show so we could get paid. She was intubated, decompensated over the next few days, and ultimately experienced cardiac arrest. We performed cardiopulmonary resuscitation, administered medications, and used defibrillation for well over 1.5 hours before pronouncing her time of death. The worst part was calling her husband and being accused of injecting her with coronavirus disease 2019 as an experiment and killing her. He had to be escorted out of the hospital when he came in without a mask and tried to get up to the unit. This is getting exhausting. Story 7. Last summer, a man came to the emergency department with symptoms and tested positive. He refused admission for the usual reasons. He said it was a complete hoax, or that it was not that serious and that he was strong enough. A couple of days later, he returned to the emergency department with his mother, who lived with him and was now symptomatic. They were both admitted and eventually placed on ventilators. The man survived, but his mother did not. Story 8. I am an emergency room doctor. I diagnose people with coronavirus disease 2019 on a daily basis. Some people are very cooperative about it. Others are more difficult. Here is a tale from my most recent shift with back-to-back rooms and patients. Patient A in room 4 is a 23-year-old man with no medical history. He presented with body aches, malaise, and fatigue. He also had mild nausea without abdominal pain or vomiting. Patient B in room 5 is a 51-year-old woman with a history of intermittent asthma, so she uses an inhaler infrequently. She presented with shortness of breath and possible fevers at home. In triage, it was noted that her oxygen saturations were around 88% and her heart rate was not elevated. When asked if she thought she had coronavirus disease 2019, she said, "I can't have it. I tested negative 2 weeks ago when my son tested positive. He has been sick at home." Both patients tested positive for coronavirus disease 2019. Patient A went home and is doing well. He was extremely remorseful and, before he even left the emergency department, he called his workplace to let them know he was positive and to get everyone tested because he believed he had contracted the illness at work. If I recall correctly, he worked in a small family-owned warehouse as a foreman. He also called his parents, and they arranged for him to sleep in the garage until his quarantine ended. I respected him. Patient B was admitted to the hospital because her oxygen saturations were low. When I returned to tell her she was positive for coronavirus disease 2019, she called me a liar and said I must have made a mistake. She threatened to leave against medical advice, but when she stood up, she became so short of breath that the nurse persuaded her to stay. People are strange sometimes. I try not to let things bother me, but people who deny the seriousness of coronavirus disease 2019 come close to crossing that line. Story 9. I am an emergency room doctor. A few months ago, I had a patient who refused to wear a mask. I calmly explained that hospital policy during the pandemic requires everyone to wear one to protect each other. He appeared to accept this at first, but he repeatedly insisted the mask made it impossible for him to breathe, and claimed he knew all the science and that masks cannot stop viral transmission. He then became very agitated, removed his mask, and started screaming about 2 inches from my face, calling me stupid and using severe abusive language. He told me to man up and that it was not a big deal, then stormed off coughing. 2 things. First, millions of confirmed deaths worldwide, and probably at least 1 million uncounted deaths, constitute a major concern. Even if infection does not kill you because you are young and healthy, it can still cause serious harm. I have seen strokes, heart attacks, blood clots, new-onset type 1 diabetes, and bowel obstructions, even in people who are young and otherwise healthy. Get vaccinated when you are able. Second, you cannot claim a mask makes it impossible to breathe and also claim it does not stop transmission. A virus particle is much larger than an oxygen molecule, roughly 1,000 times larger. It does not make sense to say a mask would magically block oxygen but allow a much larger virus to pass through. Story 10. I am not a doctor, but I am a respiratory therapist. We had a patient, a mother of 3, on FaceTime with her boyfriend, denying it was real right up to the moment we intubated her. Guess who ended up with a tracheostomy and a percutaneous endoscopic gastrostomy and never came off a ventilator until she died? Story 11. Not a doctor, but a registered nurse. I lost count of the number of patients I had who denied COVID-19, even right up until their last breath. During the peak in January, an average shift had me spend an hour or 2 being yelled at by patients' family members who said COVID-19 was fake and insisted they could not be kept from seeing their relative. Then I would spend the shift sweating and running around trying to keep everyone as comfortable as possible, maintaining their oxygen, and often repeatedly having to put someone's oxygen back on after they insisted they did not need it. Multiple times I was told we had it all wrong, that it was just a cold, or that they were not that sick and did not need oxygen even as they ran out of breath trying to get out a single word. Being in a strongly conservative rural area, it was to be expected. We even had nurses who denied COVID-19 for a long time. Eventually they got the picture and complied with infection control practices. One of the worst cases that stuck with me was not a COVID-19 denier. The patient believed in COVID-19 and was a wonderful person, but they were elderly and had a caretaker who did not believe in COVID-19 and refused to wear a mask. When the caretaker tested positive, they refused to quarantine or tell the patient and kept caring for them, insisting COVID-19 was fake. That person ended up contracting COVID-19 and being admitted to our unit. Story 12. The patient understood and agreed to all treatment. Their son, however, called every day to yell at us for testing the patient, accusing the doctors of being under the government's influence and spreading lies sponsored by the Centers for Disease Control and Prevention. He even demanded that we print the patient's entire medical record to prove that we were lying. It was horrible to see this side of people during the pandemic. Story 13. I am a nurse. I had coronavirus disease 2019 and now I am in rehabilitation because my lungs are at 70% capacity. I was at 40% capacity before, and when I hear someone say that I have the urge to slap them with a chair, I will need another year to fully recover. Thank you for the kind words and the awards. You are all awesome. Story 14. My wife is a nurse. She had to care for a patient who refused to be tested for coronavirus disease 2019 before her surgery. So staff treated her as a coronavirus disease 2019 patient and charged her for all the added personal protective equipment, such as gowns and goggles and other protective items. The post-anesthesia care unit would not take her for observation while she was waking up, so the anesthesiologist had to remain and monitor her in the operating room for nearly 3 hours. She was billed $400 per 15 minutes, and there is no way her insurance will cover the extra cost because she signed a document declining a coronavirus disease 2019 test. Story 15. I am a doctor working in acute internal medicine. I have seen a lot of coronavirus disease 2019 cases over the last 12 months, probably more than 300. The one that sticks in my mind most is a 70-year-old woman with chronic obstructive pulmonary disease. She refused vaccination because she did not trust it, despite being eligible for vaccination for weeks beforehand in the United Kingdom. She subsequently contracted coronavirus disease 2019 and was admitted to hospital. She repeatedly doubted that diagnosis. She refused transfer to our coronavirus disease 2019 high dependency unit despite significant respiratory failure. She deteriorated over several days to the point where she was on maximal oxygen on the ward, and at that point finally accepted treatment in the high dependency unit with high-flow oxygen, although she continued to doubt she had coronavirus disease 2019. She died within 24 hours of her admission to the high dependency unit after refusing transfer to the intensive care unit. Her family insisted she never had coronavirus disease 2019 and accused us of withholding life-saving treatment. Unfortunately, there is no treatment for stupidity. Story 16. As an anesthesiologist, by the time someone is calling for us, it is for intubation and the patient is in no condition to refuse. Honestly, it is usually the family members who are the issue and need to be escorted from the room. Story 17. My worst experience was when a 2-year-old child was diagnosed with coronavirus disease 2019. His mother brought him presenting with fever and diarrhea. The child was severely dehydrated, so we performed a mandatory swab test because we planned to admit him. The test was positive, and the mother refused to admit him. We offered a repeat test and advised the parents to get tested. She said, "The child never left the house. Only she and the father go to work daily, and the grandmother babysits while they are away." She asked how he could have coronavirus disease 2019 without leaving the house. She called her husband. He arrived with 10 to 15 relatives in a car. They broke a few chairs and then left with the baby. We reported the case to the Coronavirus Disease 2019 Control Center. Story 18. I am not a doctor, but my wife and several family friends are. One of them practices sports medicine and family medicine. Patient came in and refused to wear a mask. Our friend refused to treat him until he agreed to mask up because he had a newborn at home. When our friend told him he most likely had coronavirus disease 2019 and needed to go to Tampa General Hospital immediately for testing and treatment, the patient said it was fake and that he only needed antibiotics. He left without a prescription and called back that night, demanding oxygen. Our friend told him his only option was to go to the hospital. The patient had a severe case of the disease and was hospitalized for several weeks, but he still insists it was only a severe flu. Story 19. He repeatedly denied having the infection, claimed he had another condition, and attempted to leave against medical advice while on high-flow nasal cannula. We did not allow him to leave because he would have died within minutes. Before he was admitted to the hospital, he was symptomatic but refused to isolate at home. He transmitted the infection to his wife, who ended up in the intensive care unit. Story 20. I am an anesthesiologist. At our institution, we are responsible for intubating patients suspected or confirmed to have coronavirus disease 2019, who would otherwise die without ventilatory support. Astonishingly, many patients do not believe coronavirus disease 2019 is real. Most of them believe it is an elaborate lie that doctors use to label patients and obtain money from them. Some scream at us as much as their damaged lungs allow. Some outright refuse intubation and die several hours later from respiratory failure. It is emotionally taxing to face that every shift. Story 21. I am a student funeral director, and I see families attend the funeral of someone who died of coronavirus disease 2019 and still deny it. They started out shrieking at the doctors to change the cause of death on the death certificate. Now the Federal Emergency Management Agency is helping with funeral expenses for coronavirus disease 2019 deaths. Suddenly there is a change of heart. Story 22. My mother works for an obstetrician-gynecologist who specializes in high-risk pregnancies and births. He was called into the hospital to evaluate a woman whose due date was about 2 weeks away and who was very ill. He confirmed she had coronavirus disease 2019 and admitted her to the hospital until she gave birth, but she insisted it was a hoax and left against medical advice. Before leaving, she spat in the face of a nurse who had just completed chemotherapy. This was near the beginning of the pandemic, and I am curious what happened to that woman. The nurse is okay, thank goodness. Story 23. I am a registered nurse who spent most of 2020 working during the coronavirus disease 2019 pandemic. I never had anyone refuse treatment when things became serious. Some of the medical doctors I worked with were yelled at, as were the rest of us, and that happens frequently. Some patients who denied the severity of the illness survived. Many of them had accepted reality by the end of their stay after seeing what we were doing to treat them. Some died while telling me I was a sheep, an idiot, or a liar between gasps of air. The coronavirus disease 2019 did not care. Story 24. I still had to treat her despite her accusing me of hiding the real diagnosis from her and of doing something to make her sicker. I love my job. Story 25. I'm not a doctor, but when my grandmother was dying, my relatives kept pressuring me and the doctors to say what it really was. It added stress to an already difficult situation and was embarrassing. After she died, they suggested she might have had a stroke and been misdiagnosed, or that the doctors did not want to help her. I was trying to arrange with hospice to be able to go in and say goodbye, while a second cousin was sending me YouTube videos claiming the coronavirus disease 2019 is fake. I was already not close to these people, and I am glad they are out of my life now. Story 26. I work on a coronavirus disease 2019 unit, and I encountered a patient like this. They repeatedly told me they were not really sick and that I did not need to be gowned in personal protective equipment. They even tried to remove my face shield. 2 positive tests confirmed coronavirus disease 2019. This behavior was alarming. Story 27. An emergency room doctor told me I was wrong and insisted there was no way the patient had coronavirus disease 2019 despite presenting to the emergency room with shortness of breath, cough, and fever. When I mentioned that the patient's wife in a nearby room also had coronavirus disease 2019, the doctor said it made sense because she always gets sick. When I asked how the doctor could rule out coronavirus disease 2019 in the patient with the same symptoms, I was told it was because the patient was generally healthy and had only removed their mask to eat and drink in the casino. Story 28. This is not a case of diagnosing a coronavirus denier, but I had a patient who refused testing upon admission and loudly yelled that coronavirus is a hoax. I calmly told the nurse that since we would not know his status, she should admit him to the coronavirus ward. He instantly became a believer and requested to be tested. I work in a major city in the United States. Across our health system, we do our best not to admit an untested patient to a floor for patients who have tested negative. Patients who are exposed or who refuse testing are designated as patient under investigation and are admitted to a separate floor with other patients under investigation. This floor also houses patients who have tested positive for coronavirus but are not in the intensive care unit. All patients are kept separate from one another in private rooms. I hope this clarifies that we are not placing all patients together in a petri dish of coronavirus. I am a physician, a trauma surgeon, a surgical critical care intensivist, and the director of a surgical intensive care unit that also serves as the coronavirus intensive care unit during case spikes. Story 29. I am not a doctor, but I am a nurse who worked in one of our coronavirus disease 2019 intensive care units. The patient had been intubated, sedated, and proned, a therapy that involves placing the patient on their stomach to improve lung oxygenation and is reserved for very sick patients with coronavirus disease 2019. Miraculously, she recovered and was weaned down to a high-flow nasal cannula, which still requires relatively high oxygen but is better than a breathing tube. She would deliberately cough on the nurses when we entered her room to administer medications and provide care, while shouting that coronavirus disease 2019 was not real and accusing us of giving it to her. That winter was awful. Story 30. I had a woman who was receiving maximal support from high-flow nasal cannula oxygen. The next step would have been endotracheal intubation, but she refused. She insisted she had coronavirus disease 2019 and was holding a negative test result taken 1 week earlier. Story 31. Family members have brought a sick relative and lied about exposure or symptoms despite a household member testing positive. This has led to inappropriate management, delays in treatment, and exposure of staff and other families. Family members then become angry when asked to isolate. Story 32. I'm an attending physician at our triage unit. On a Friday, an older gentleman in his 60s came in with his entire family. His wife, his sister, his brother-in-law, 2 nephews, and 3 children. None of them were wearing face masks. All had mild symptoms of coronavirus disease 2019 except him. He had an oxygen saturation of 80% with evident shortness of breath. We insisted on performing a polymerase chain reaction test and a computed tomography scan to look for coronavirus disease 2019, but he and his wife refused, saying the disease was not real and it was just a bacterial infection. The more we spoke with him, the more agitated he became and his face reddened. We suggested hospitalizing him to stabilize him and start treatment, but they accused us of exaggerating his symptoms and said we only wanted to hospitalize him so we could steal the fluid from his knees, a rumor that circulated early in the pandemic. They cursed at us and said they were going to a different hospital to get antibiotics. Fast forward 24 hours, on Saturday we received a call from a hospital in the next county saying they had intubated one of our patients because he arrived in respiratory failure, and they needed to transfer him here because they did not have the appropriate equipment. We transferred the patient on Sunday. The computed tomography scan showed 90% lung damage. He passed away on Monday morning. Just before the family took the body away, I gave the widow the death certificate that I had completed. Before I walked away, she turned around, waved the certificate, and yelled that it was not coronavirus disease 2019. She read the certificate aloud, which stated death due to pulmonary pneumonia due to severe acute respiratory syndrome coronavirus 2, and said she knew it was a bacterial infection. I told her that severe acute respiratory syndrome coronavirus 2 is the virus that causes coronavirus disease 2019. Afterwards, she yelled that it was severe acute respiratory syndrome and a bacterial infection, then stormed off. It was actually one of the mildest encounters I have had with a grieving widow. Story 33. I am not a doctor, but I work in the psychiatric area of the emergency department. There is a lot of coronavirus disease 2019 denial and paranoia based on psychiatric illness. Patients often refuse swabs because they think we are trying to implant microchips. Mention my experience to contrast psychiatrically unwell patients who deny coronavirus disease 2019 with psychologically unfit people who deny it because of propaganda, politicization, and poor critical thinking. It is interesting that the outcomes are similar in this respect. Story 34. I treated a young man in our intensive care unit with critical illness due to coronavirus disease 2019 and severe diabetic ketoacidosis. He did not believe in insulin or other anti-diabetic medications, even though insulin is inexpensive in our country. He tried to treat his type 2 diabetes with herbal remedies, and his hemoglobin A1C, the laboratory measure of long-term blood glucose control, was extremely high. He was not vaccinated despite being offered the vaccine, did not wear a mask, did not practice social distancing, and did not believe in public health measures for the coronavirus. Most of this information came from his 20-year-old daughter because he was disoriented at presentation and was intubated urgently. She sobbed on the phone every day for 1.5 months until he died. I held the phone to his ear several times when he was still intubated during periods when his sedation was optimal and his mind cleared. I believed he realized his mistake while on the ventilator with lines and tubes in place during his last lucid moments, but I cannot be certain. I often think about the last conversation and the final mental images people have before their death. Story 35. Infectious disease doctor here. I have seen between 450 and 500 patients with coronavirus disease 2019 in the hospital since the start of the pandemic. Only one patient ever accused me of using a nasal swab to infect him with coronavirus disease 2019 and to implant a microchip. A handful have ranted nonstop about China. Everyone else accepted the diagnosis, but many still refuse vaccination even after being in the intensive care unit. Immunity after infection can last as little as 3 months. Immunity from vaccination typically lasts much longer and has the benefit of not putting you and those around you at risk. You can get vaccinated as soon as you recover and are no longer in isolation. There is no need to wait 3 months. It can be longer depending on the person, but you cannot predict that ahead of time. I have a patient in the hospital right now who was reinfected at 4 months. Story 36. I am not a doctor, but my cousin-in-law was a coronavirus disease 2019 denier. He went to his girlfriend's family house for Thanksgiving without telling his parents that they were also coronavirus disease 2019 deniers. He was living with his parents, my wife's aunt and uncle, since he had recently divorced his wife. He returned, and a week later the entire girlfriend's family tested positive. He contracted the virus. His parents both became infected. His mother was in treatment for breast cancer and his father had asthma, by the way, and they are not coronavirus disease 2019 deniers. His mother recovered, but his father, my wife's uncle, went from coughing and wheezing the day after Christmas to the emergency room on New Year's Day. Within 24 hours he was placed on a ventilator. 3 weeks later he died. So my cousin-in-law effectively caused my wife's uncle's death, and that part of the family is very tense. His brothers blame him for killing their father, but their mother is not willing to blame her son. I strongly condemn coronavirus disease 2019 deniers. This is not a joke. These people are literally killing others through gross negligence and stupidity. Story 37. I am a family doctor who mostly practices outpatient care. I live in a fairly conservative area with a significant number of people who deny coronavirus disease 2019, so I have been seeing such patients since this became politicized. I have lost a few patients over the mask mandate. Several of my patients who denied coronavirus disease 2019 have completely changed their attitudes after they, or a close family member, contracted the virus. Even when their case was not severe, the sudden terror that they could end up on a ventilator overnight really scared them. Despite receiving a diagnosis of coronavirus disease 2019, some patients remain obnoxious. They generally dig in deeper into paranoia, not about the virus itself but about the circumstances of how they contracted it. Patients have said things like, "If Dr. Anthony Fauci had done his job from the beginning, it never would have reached this town. It is entirely the fault of the Affordable Care Act that I cannot get the experimental immunoglobulin treatment. It is not. Eligibility for the infusion depends on a list of risk factors." And probably my favorite. "So I have coronavirus disease 2019 and it is completely your responsibility to fix it. I need you to send hydroxychloroquine, zinc, vitamin D, lisinopril, and azithromycin to the pharmacy. Then they get angry when I do not." Yes, each of those statements was actually said to me after the patients received their diagnosis. I could think of more, but those were the most memorable ones. Story 38. I am an operating department practitioner and work alongside anesthetists in theaters and the intensive care unit. I have not really seen outright denial from patients. However, I have seen some friends on Facebook spreading lies. One of them, a friend of my wife, works at the hospital in administration. She refuses to wear a mask and even bought a certificate from the internet so she does not have to wear one in public. This is being escalated through the disciplinary process. Story 39. I was testing a man yesterday who asked if he still needed to be tested to be on a college campus even though he had received both doses of the Pfizer vaccine. I said yes. It is a mandate from the Centers for Disease Control and Prevention, and there is not enough longitudinal study on the current vaccine's effectiveness against the variants to change that yet. So we keep testing everyone once a week. Then he said, "You know, all this coronavirus disease 2019 crap is nonsense, right? The government and secret groups are trying to suppress us." I told him that 92 people have died of coronavirus disease 2019 under my care in the last 14 months, to keep his QAnon conspiracy movement garbage to himself, and to have a nice day. I was reprimanded this morning. It was worth it, the lightest slap on the wrist of my life. Edit. Thanks for the attention. Instead of awards that cost money, I recommend donating to the Nurses' House, a foundation that assists registered nurses struggling with mental and financial well-being. They do great work. Thanks again. Story 40. I am a medical spouse. My husband works as a hospitalist in a rural hospital 1 week each month. He went to help in the emergency room because they had a patient who needed to be intubated and who was positive for coronavirus disease 2019 but did not believe in the disease. The patient's oxygen level dropped to around 60 to 70%, which is severely hypoxic, so they told him he needed to be intubated. The patient screamed at my husband that he was lying and would sue if he intubated him. My husband asked if he could do it if the man stopped breathing. The man replied, "Well, that's different." He waited about 15 minutes for the man to lose consciousness from lack of oxygen, then intubated him and walked out. Story 41. Not a doctor, but a university friend of mine has been a nurse in a coronavirus disease 2019 ward since April 2020. She said she has lost count of how many people she has seen die while denying coronavirus disease 2019 is real, and how families sometimes freak out at healthcare workers and accuse them of staging it for the media. One woman tested positive but initially had mild symptoms. Because of her age and other health issues, staff wanted to put her on oxygen early as a precaution. She refused and went home, then returned in less than 24 hours severely ill and unable to breathe. She claimed someone must have injected her with chemicals from a Wuhan laboratory while she was at the hospital the day before, then also insisted it was fake. She repeatedly said God was allowing Satan to test her faith and that she would remain in the hospital but refused treatment. She accepted a saline intravenous line, then removed it and said it was full of vaccine tests intended to eradicate white people. She demanded that her family be allowed into the coronavirus disease 2019 ward without masks. Over about 48 hours, she grew progressively sicker, and before she lost consciousness, she told my friend, "You'll burn in hell for your part in this." My friend also told a story about a man who had coronavirus disease 2019 twice and was hospitalized for over 3 months during 2020 to 2021. When enough time had passed after his second infection, she recommended he get vaccinated because he appeared especially susceptible. The first time his illness had been mild, so he continued going to bars and restaurants without a mask in a very conservative area where places never closed. Who knows how many people he infected? His reply to her suggestion was, "Now why the fuck would I want to let those goddamn Chinese track me like that? I won't get something that isn't real. Bitch, you almost died." Story 42. I have been confrontational with these patients out of respect for my intensive care unit colleagues and nurses. They put their lives on the line for what I view as stubbornness. I essentially ask these patients to cure heart disease, stroke, ulcerative colitis, and Crohn's disease since they have decided that coronavirus disease 2019 is fake. I ask them if they have any thoughts on recent stenting medications or immunomodulatory medications, and if they are aware of any medications in the pipeline, since they believe they are more knowledgeable than I am. I also ask how well they did in math in school so I can better understand probabilities. Story 43. A couple in their mid-60s, extremely wealthy, came to the hospital with all the symptoms of coronavirus disease 2019. They insisted the disease did not exist and said it was just the flu. They drank hot tea with lemon and honey at home and took ibuprofen for fever, believing everything would be all right. They refused hospitalization, attempted to sue the hospital with an army of lawyers, and left after signing discharge papers. 2 days later, they returned to the hospital and were dead. Their son was in Japan and never came to claim their bodies. He only called to confirm his parents' deaths. Story 44. Our neighbor was a coronavirus disease 2019 denier. He insisted his healthy lifestyle and CrossFit meant it was only a bad cold. He now uses a mobility scooter to reach the mailbox. He speaks with a voice similar to Stevie from Malcolm in the Middle. He takes more medications than people twice his age and cannot taste or smell anything. Story 45. A friend of mine did not believe coronavirus disease 2019 was serious. Another close friend became very ill and the non-believing friend gave him a hard time for not being online to game and hang out and for sleeping all day to recover. That sick friend's mother had the illness twice, but both times were mild. She said the second time she was sicker than the first. Then everyone at his workplace, including him, tested positive for coronavirus disease 2019. His case was so severe it almost killed him. During his hospital stay, they discovered he had diabetes. After he was released, he apologized to our friend for having downplayed coronavirus disease 2019. Story 46. I am not a doctor, but I work at an urgent care clinic that performs coronavirus disease polymerase chain reaction testing. A woman tested positive and, for the entirety of her mandatory quarantine, would not stop calling the clinic. She insisted that we were running a scam by reporting positive tests to the Internal Revenue Service and receiving kickbacks. We do not report to anyone besides the state, and even the state does not do much. I felt bad for her. She was an immigrant working as a nanny off the books and was fired when she became ill. She felt very alone and did not know how to handle her situation. As someone who contracted coronavirus disease myself, I understood her frustration. You feel like you just get handed this test result, your life stops, and you are still expected to pay rent, buy groceries, and so on. That does not justify denying a very real virus, but it is still sad. Story 47. I am a doctor. I was working in the coronavirus disease 2019 intensive care unit as a resident physician. We were overwhelmed with new patients and the intensive care units were overflowing. I admitted an elderly man around 2 in the morning with respiratory failure. Due to coronavirus disease 2019, he was maintaining his oxygen saturation with high-flow nasal cannula oxygen, but he was notably short of breath and unable to speak full sentences without gasping for air. At that point in the night, I had been working about 22 hours into my 28-hour call shift. All I wanted was to take a quick history and physical and get out of the room to reduce my exposure. He proceeded to tell me that coronavirus disease 2019 was a hoax and began rambling about a Bible passage. He even told me I needed to read the Bible more. I was too emotionally and physically drained to respond to the audacity of his comments. He was later intubated and spent a week on the ventilator. I think he survived, but it was hard to remember. To say this pandemic made me cynical is an understatement. Story 48. I think it is far worse when a medical clinic is full of deniers. In my city, a large and highly respected medical group was a hotbed of cases of coronavirus disease 2019 last year. They continued to work while actively infected and without wearing masks. This is a medical group, but the building also houses a restaurant, a florist, plastic surgeons, and physical therapists, along with general and family practitioners. This put everyone at risk. Story 49. I am not a doctor, but I worked as a 911 dispatcher for a few months when coronavirus disease 2019 was still new. I got a call from a woman who claimed she had found a cure and had taken it herself because she had tested positive and felt much better. When I asked what the cure was, she said half a cup of bleach and the other half red wine. As soon as she told me this, I sent an ambulance, but she refused to go to the hospital and kicked a paramedic. 5 hours into my shift, I received a call from a young man who had just come home from work. His mother was unresponsive. When I asked for the address, it was the same one the woman had given me earlier. The same paramedics went and confirmed she was dead. Story 50. I am not a doctor, but I am an emergency medical technician. The patient had already been diagnosed and was being transferred to a different hospital. During the trip, he kept insisting he was not sick and at one point even tried to rip off my respirator. That was a stressful situation. Story 51. I am a medical doctor. He still refused to wear a mask and to self-isolate even after I explained the risk to his family and the public. The next week, his wife was in the intensive care unit. Story 52. This is not about me. I work in retail as a key worker, but a colleague of mine is a trainee nurse. One day she came in very upset and told us she had cared for a woman who tested positive for coronavirus disease 2019, was on a ventilator, and was dying. In her final moments, the woman's partner shouted at her, "Stop being so dramatic. Coronavirus disease 2019 isn't real. You just need to believe you'll get better." After the woman passed, he started screaming at the doctors and nurses, accusing them of killing her or injecting her with something and refusing to accept the truth. It was heartbreaking. Sometimes we still talk about her. I hope she found peace. Story 53. I want to thank all of the doctors, nurses, and medical staff in this thread for continuing to work hard, risking their own health to help others, and for exercising incredible patience when dealing with difficult people. Story 54. The main thing I have learned from this pandemic is that if we ever have to face another one that is more deadly than coronavirus disease 2019, we are royally fucked. Story 55. I was telling my employee, who is a coronavirus disease 2019 denier, how my cousin's husband died of coronavirus disease 2019 unexpectedly. Her response was that they labeled it coronavirus disease 2019, but it was probably something else. I did not know how to respond, so I just left. Story 56. My roommate told me about a patient who refused to believe she had coronavirus disease 2019, even when they intubated her. She died a few days later. Cognitive dissonance is a powerful force. I think the last-minute denials were a form of self-preservation. At that point, I do not think she could mentally handle that her own reckless behavior led to her death and that it was completely avoidable. Story 57. I had the opposite experience. I developed serious symptoms in March 2020. Cough, fever, body aches, and other symptoms, so I emailed my doctor because I thought I might have the new disease in the news. I did not want to go in because it was reported to be highly contagious. He told me it was nothing to worry about and to drink fluids. I started feeling worse over the next 2 days and learned that someone I had been near tested positive, so I contacted him again with that information. He again told me it was not serious and refused to test me. I asked him, out of an abundance of caution, how long I should quarantine, since I could easily work from home and had enough food to last a couple of weeks. He told me it was highly unlikely that I had coronavirus disease 2019, COVID-19, and said I could go out in public if I wanted to. Later that year, I took an antibody test which showed I had antibodies. Many others may have had coronavirus disease 2019, COVID-19, that he did not test for and told to go out in public. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.